Okay. Hi, everyone. This is Dr. Pentel. I'm board certified dermatologist at Southside Dermatology. And tonight we're going to talk about Mommy Makeover, non-invasive treatments for cellulite, stretch marks, the mommy pooch, stress urinary incontinence, and vaginal tightening. This is a lot, so let's get started. So as we know, lots of us have cellulite. In fact, 90% of women have cellulite. And in the study, they found that a lot of us, over 50% of us, are really bothered by cellulite. We feel judged, and some of us feel that it's their fault, but cellulite is not your fault. However, a lot of times we feel like we can't do anything because there was a lack of effective treatment out there. But nowadays, we do have treatments that work, and that's what we're going to talk about. So we all have different types of cellulite. We can have mild cellulite or cellulite where the dimples are there even when we're sitting or standing. That's a little bit more moderate to severe cellulite. Now, there are three main causes of cellulite. As you can see, as you get older, you have these fiber strands underneath your skin that gets really thick. And what does that do? It pulls down the skin. So it causes this mattress-like dimpling, tuffing-like appearance. That's, to me, one of the primary root of cellulite. Then as you get older or as you gain weight, your fat cells get larger. And so the fat lobules bulge through the skin. And so that's why you can see more of those lumps and bumps. And then as you get older, the skin gets thinner and a little looser. And that we call laxicity. But the main really root of cellulite is actually those fiber bands underneath the skin called septae that is pulling down on your skin that causes that rippling effect. So how do we know if it's cellulite or just loose skin, laxicity? Now remember, you can have both, but a test that really tells you is if you sort of pull up your skin or stretch your skin, if those dimples go away, then it's not cellulite. The cellulite, the dimples will still be there. So if you have loose skin, the loose skin will you still have laxicity. So that will straighten out. And we have lots of different devices that will help with laxicity and also cellulite. So let's talk about non-invasive treatments for cellulite. To cut the fiber strands, the primary root of cellulite, there's two main things. You can use Quo, which is a new FDA-approved injectable enzymatic subcision. So it uses more of an injection. Or Sulfina, where you're using a device and you're using a small needle device, a microblade to cut down the fiber strands. Or you can heat the underlying tissue for your support and your tightening. So we use Profound to do that, or VeloShape 3, which is more of a no downtime. But this also is a temporary solution. The other three tends to have more long-term, long-lasting results. So Quo, let's talk about Quo. It's the first and only injectable treatment for cellulite. In the studies, they study dimplings in the buttocks of females, and it's moderate and severe is really what they're studying. But they study in all skin types and all different BMIs. So this is a video that is a cellulite. Now, of course, we don't have two people injecting you at one time, but this would be a good, I apologize for this. Let me see, here we go. Here is a video. So as you can see, each dimples get an injection. You go down once, then you go down north, and then you go down south. Then you move to the next dimple, and you do the same thing. And usually you can inject more in the buttocks area. Now, if you do the thighs, it is off-label. So the studies were just done on buttocks. In summary, it is an enzymatic subcision of the fibrous septae. The studies were done on buttocks, so off-label treatments for thighs. You do 3 sessions every 21 days. Each session takes around 15-30 minutes because we also take pictures. We want to identify the dimples that bothers you to make sure that we address those. We treat all skin types. You can treat all BMIs. There's no downtime. You can resume normal activities. However, we prefer that you don't have any history of bleeding disorders. So bruising is honestly one of the most common side effects of Quo. Now, bruising happens around 84% of the studies in the subject. But the bruising gets better and better each time. So the first treatment you might session, the second session your bruising is less, and the third session is as less than the first and the second one. So as you can see, in day 3 you have bruising the first, and then second time, the third time is less. Now, other causes of risk is also nodules, but that usually go away with the next treatment, and also soreness and tenderness, but that always resolve. So here we also have a before and after a quote. As you can see, those dimples in the buttocks has pretty much smoothed out. The same thing right here. Great before and after photos, and the same things here. Now this person has a little bit of laxicity, as you can see. So with that, we can probably use some other devices to treat the looseness and the laxicity. But however, just treating some of those dimples really does help that rippling effect. So this is with laxicity and without. So remember the stretch test, that's how you can tell, but you can use the quote for both patients with or without laxicity, just treating the dimples. Let's talk about Selfina. Now, Selfina does the same thing pretty much as Quo, where it cuts those fiber strands, but now we do it with a mechanical device. So when you cut those bands, the skin bounces back and becomes smoother. Then the study was done on buttocks and thighs. So this is the device that we use, the one in the right top corner. We first had to put tumescent anesthesia. So then we numb the whole area. After we numb the whole area that we're treating, then we use the device on the left bottom where there is a blade. As you can see, we put it on their skin, we go in and we cut those fiber strands to release the dimple. Now, it is usually one treatment. The results last around 3 and sometimes now 5 years. We've had it for, I think, around 5 years or more. And some patients still have good response. But tumescent injectable anesthesia is needed. So you have more, I guess, pokes. There's still considered bruising, soreness, tenderness. But again, these side effects are self-limited. But with this one, we recommend there's no physical activities for 2 to 3 weeks. This is a Selfina patient. As you can see, those dimples that we have subsided with the microblade has gone away, and the one also in the bottom. Again, this is treating the thighs and the buttocks, and again, good results with Selfina for cellulite. Now let's talk about Profound for cellulite. Now Profound, most people have heard before because we also use it for the face because it is the device that increases elastin, collagen, and hyaluronic acid. So we use there's 2 tips. There's a dermal tip that we tend to use for skin tightening. And there's a subcutaneous tip that we also use for submental fat. So we can use both for skin tightening and submental fat. Now that the deeper treatments, we use, or the deeper, the sub-Q, I guess, applicator, treatment tip, we use for fat, to melt fat, and cellulite. But sometimes the skin is thin, so sometimes we can get away with using the subdermal one also for skin modeling and cellulite. It is usually one treatment, it's long lasting, and again, the side effects, that's with anything, bruises, tenderness, swelling, and post-inflammatory hyperpigmentation. Now with these, because you have these small needles that go into your skin after you are completely numb, there is more risk of what we call PIH. So this is Profound for cellulite. I really like Profound when I see a lot more of a skin tightening effect. However, because of the skin tightening effects, you can see some of the dimples are also treated too. Again, with this, so I would say this patient has a little bit more of a rippling for that probably needs more skin tightening, but again, it can be treated for both cellulite and skin tightening. Profound is also used for our Mommy Pooch. And this, because it can also melt fat and do skin tightening, is a great procedure. Let's talk about VeloShape. So what if you don't want injection? What if you don't want the subcision or any needles going to your skin? You could choose VeloShape. We have the third, I guess, device, or they have VeloShape 1, 2, and 3. Now with this one, you use bipolar radial frequency to heat deeper. You have infrared that heats more superficial. However, this also has a vacuum and a massage to also help increase circulation and lymphatic drainage. So you're remodeling the skin, you have decrease in elasticity, decrease in volume, and overall improvement in skin. However, this one is more temporary, so you can do it, and then you may need to repeat it to maintain your results. But this one, there's no needles, there's no numbing, there's nothing. So this is actually the one if you don't want any downtime. So this is a VeloShape, just to show you that it is it's like honestly a hot stone massage, just sort of helping you with the cellulite and tightening your skin. This is a photo of a VeloShape 3 before and after. Again, in my opinion, this helps more with the skin tightening and the rippling and the laxicity. I don't think this helps as much with the dimples. So if you have more of the dimples, then the subcision with the Quo and the injectable with the Selfina may help you more. Again, this is great for skin irregularities to help with skin elasticity to smooth out the skin. Now, do you love your stretch marks? Who likes their stretch marks? I think everyone would say no, I do not like my stretch marks. So what can we do about it? First, let's look at stretch marks. What can they look like? Actually, stretch marks usually starts red, okay? So you treat them early, all right? And they also are darker in color, so it could be hyperpigmented. Or if you had stretch marks for a while, they turn sort of white, more of a stria alba, we call it. So exact etiology, what causes it, is really unknown. But myself and others think that maybe it's stretch mark scars because they kind of get treated similar to scars. It's associated with pregnancy, puberty, rapid weight changes, or muscular changes. Sometimes there is genetic predisposition to it. There is loss of elastin and collagen and some epidermal thinning. So this is kind of what we also see with scars. However, to treat them, this is also devices we use with scar. You stimulate collagen and elastin. We use that with our radiofrequency devices. We use that with our lasers, like our Norlis 1550 or our Fraxel Dual 1550. There's also another laser, at 1470, which is our halo laser that also can treat stretch marks too. We also, though, treat vascular, the redness with a stretch mark with our V-beam pulse dye laser and XLV laser, which are both of these are our vascular laser. So the best response is to treat these early red stretch marks. So let's talk about the E2 sublative. This is a radio frequency devices, but it does not really have disruption of the epidermal layer, so very, very little or minimal to no downtime. But there's a lot of high dermal remodeling. That means you do a lot of heating of the collagen and the subcutaneous, underneath your skin. So these are things that E2 can treat, you know, wrinkles, under eye wrinkles. It can treat acne scarring and stretch marks. So stretch marks are very hard to see when you're looking at photographs because it's hard to capture that stria. But as you can see here, there's definitely an improvement in your stretch marks. And stretch marks here, after 2 treatments, most stretch marks require multiple treatments, of course. Now, with this one, the microneedling radiofrequency, let me explain what it does. Okay, so you hear a lot about microneedling radiofrequency or radiofrequency, and you hear bipolar versus monopolar. So the bipolar, you have these 2 sort of, points of contact, and the radiofrequency goes between both. So in between those things, you have the skin that you can remodel. Versus the monopolar, where if you heard my talk before, we talk about true scope, we talk about thermage, we talk about a whole bunch of other things where you are heating fat, you're heating deeper. So that's monopolar, where usually it's something on your skin, but something you have like a connection or a pad on your back. So that's called the deep heating part. When you're talking about microneedling radiofrequency, these are between 2 poles. And in between it, that's where the energy goes to help treat it. So the Genius RF and the Secret RF is microneedling RF. So it helps regenerate new elastin and collagen. So this is the Genius and the Secret RF to help tighten skin and help with stretch marks. And this is our lasers, either the 1550, and so there's a Norlis Frax and a Fraxel Dual that has the same wavelength, which is the 1550 to help stimulate collagen. And as we stated before, using our vascular laser, the V-beam laser and the XLV laser really does help more with the stretch marks. The earlier you treat these stretch marks, the better success rates that you have. Some more pictures of treating the red stretch marks. Now let's talk about the tummy pooch. We all, after give birth, we have a little bit of a tummy that we always want to lose. So what can we do about that? Well, my previous talk about non-invasive fat reduction, we talk about 3 main ways that we melt fat. We can either freeze the fat with cool sculpting. We can melt the fat with TrueScope ID, that remember that monopolar microneedling that we talked about, the Profound with the deeper sub-Q handpiece, liposonics, or we can shake up the fat with Ultra Shape or the Ultimate Contour, which has low intensity ultrasound and radio frequency. So all these 3 ways does help with fat reduction. Now, I love my Melt, Tighten, and Tone. It works very well because you're doing the True Body, which is the True Scope ID to help melt fat and tighten skin. And the Flex, which helps to tone your muscle and also helps with visceral fat. Now, this is our Melt, Tighten, and Tone, where again, you melt the fat and I like it because it also helps tighten your skin and it helps with toning your muscle. I do not like to exercise and I don't like to eat, which I know I do like to eat. I don't eat well, but you should exercise and should eat well. However, because I'm kind of lazy and I don't do that, I do these devices. And the bottom picture is my picture after 3 months of having the True Scope ID and the Flex to help melt my fat, tighten my skin, and help tone the muscle. And you can also help lose that tummy pooch with Cool Sculpting. Cool Sculpting does work. But to be honest with you, most of the studies are showing that you really need 2 treatments. So having 1 treatment, you may be lucky. You may have 1 treatment that would be very helpful, but majority of patients I know that really are pleased or really feel that the treatments have helped you actually had 2 treatment of Cool Sculpting. And of course you do it where you are doing it completely to make sure that you have that fat, the areas treated and that fits in the applicator. You can also do fat melting and skin tightening with our Ultimate Contour. It's a new device that's ultrasound and radio frequency. You can get both, and because of intro pricing, we recommend that you come in for a free consult, and we do offering this introductory pricing at our Sunbeam office. Now, what if you have this type of tummy? You see there's a little pooch, but there's something a little bit different about this, as you can see, where it looks like your muscle is a little bit separated. So what is this called? This is diastasis recti, which is the separation of your abdominal muscle after multiple pregnancy because of the stretching. So you have this sort of protrusion in the midline of the abdomen. And we really it has been shown that the True Scope Flex and the M Scope helps treat this because it's helped toning and increasing that muscle mass. Let's talk about stress urinary incontinence. Let's talk about vaginal tightening. This is a device that treats that, and it treats it very, very well. It does work. This is the Core Intima, Core CO2 Intima. It has 2 handpieces. You have the speculum internal handpieces that's sort of inserted like a speculum, and we used it to deliver laser energy to the vaginal wall to help tighten and to form new collagen. It also helps increase vascular flow there, so it helps with dryness, vaginal tightening, vaginal atrophy. Then you have the outside part that you can treat more of that loose skin in the vulva area. You can treat hyperpigmentation. You can treat any growth around that area. So with this, you can treat labial rejuvenation. We have with that sort of loose skin. You can cause the vaginal canal tightening, so the looseness. You can do the stress urinary incontinence where ladies, when we cough or when we sneeze, you have a little bit of urine leakage. And this is very, very, it does work, vaginal atrophy and post-radiation dryness. Because of doing this, it increases the blood flow to the area. So it helps with your dryness. Now, I am so happy that we're able to talk about this because in the past it was difficult because no one really knows. But now we have actually devices and procedure that actually works, that helps really your quality of life. So I'm happy that we're talking more about this because I think that there's a lot of women out there can really benefit from these type of devices to really increase your quality of life. So thank you for listening. This is a virtual event. So we are offering some specials on the Quo, the Profound Selfina, and you get the Jamarini Cellulite Treatment Cream. And so there's not a lot of topical treatments out there that I actually think works on cellulite cream, but this one's really, really promising. Their pictures are great. They have 11 ingredients in there that really does help treat cellulite. Any 20% off any stretch marks, and then the other offers. Remember, if you're not sure what is right for you, what works for you, or if you're a good candidate, we offer free consults. So please call our office. We'll be happy to talk to you, answer any of your questions. And now after this, you are gonna get an email that says, would you like to learn about more? If you respond yes, please respond yes. One of our office will contact you to sort of see if you have any questions, to bring you in for a consult to discuss more about your concerns. So after this talk, are going to have some questions. And if you answer the questions correctly, you have a choice to win these three free giveaways. The quote treatment itself, all three sessions are actually valued at around $2,500, $2,800. So this is the Jan Marini cellulite treatment cream that we were talking about. It does work. It shows great promise. If you like this event, we also have other next virtual events. I just love sort of bringing you guys new devices, things that I think will help increase your quality of life. That may be something that you may be concerned about. And then on Thursday, May 27th, we're going to talk about the Opus Plasma. So this is a plasma device, unlike any lasers or radio frequency or any devices, where it gives you ablative results like a CO2 or Erbium with non-ablative downtime. We also have the soft wave, which is a ultrasound, parallel ultrasound beams with no downtime that gives you a tightening, a tightening. And also it does help also lift your eyebrows. So anyone who has sort of, they feel more of a droopy eyebrows, this does help with that, lift that up. And also O-therapy. So these devices we can use around the summertime. That works very well. And then on Thursday, June 17th, we are going to go more into further depth about our vaginal tightening, our intimate event where we have Core Intima, the Erbium, and also the new FDA-approved Alma Duo, which is for erectile dysfunction and male enhancement. It does work. You know that there is other devices out there. This is comparable and I think maybe slightly better, that has no pain. So please invite your significant others to join us with you to listen or learn more about these type of devices on these virtual events. And if you miss any of our virtual events, please go to our website. We have lots of information on procedures or products. And also I'm recording these virtual events on our YouTube channel, Dr.P Cosmetics Made Simple, just so you can review it. And again, it's meant to educate you, to kind of take things that may be a little bit confusing, to try to explain it to you and make things more simple. So thank you so much for joining me. I know your time is valuable and I really appreciate you joining me tonight to learn more about these devices and procedure. Remember, call our office. We'd love to learn more about what concerns you and to help you develop a plan for any treatment. And thank you so much. Have a great night.